You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with John Cray, who is the Chief Technology Officer for Mental Health Technologies. Welcome to the show, John.
Thank you, Dr. Roxy. I appreciate you having me on.
It is good to have you here today. So there is a lot going on right now in mental health, and certainly AI. I can't think of a hotter topic right now. So this is just in time to have you here and to share the mental health technology journey. So before we get started, let's just have you share a little bit about your background and what you've been innovating these last few years.
So my background, I've been in technology for, over 35 years. That's been a while. Really, I have had, before this company, I've had very little exposure to the healthcare industry.
Mm-hmm.
Mostly I've been about just communications technologies and various cloud applications. But I have had some exposure to various clinics and hospitals over the years as customers of some of our technologies. This company I got associated with really because I know the CEO very well. We've worked together for 25 years, basically, in various companies. So when he decided to start the company, he brought me on as an advisor at first, and then I joined the company full-time about a year ago. But it's really an exciting company. It's one where you get up in the morning and you actually feel good about where you work. You feel like you're doing something for people, for society. So it's kind of was a no-brainer for me to join them and kind of do this together. So it's been great.
So tell us a little bit about mental health technologies and what you are bringing to market.
So the company is really oriented around automating the mental health testing process for patients of a clinic, a hospital, a healthcare organization.
Mm-hmm.
So what does that mean? So as you might imagine, mental health is one of those areas that is difficult to test. It's not like taking a blood test or, taking your blood pressure. There's no easy way to just put a number to a mental health condition. But there are these standardized tests that have been built up over the years that try to do that. They measure levels of depression, they measure levels of anxiety, of addiction, of pain level, of whatever it might be, OCD, ADHD. There are various tests that you can do that have kind of been adopted in the industry.
Mm-hmm.
And if it were just that easy, that would be the end of the story. But as it turns out, it's really difficult to, number one, get patients to give honest answers to those tests, and to use them smartly. Like, when do you test? How do you test? What tests do you put together? What do you do with the results? How do you make it actionable? All those factors make it actually really tricky to make good use of standardized testing for mental health and to make a difference for patients. What we're really about is early recognition of mental health situations and then doing something actionable and practical with the information you find. And we can dive into that, but that's kind of what we're about.
So you kind of touched on this a little bit, but there's so many innovators out there like your company that are trying to solve this major mental health crisis that we have across the country. So just either repeat it again, or let's kind of peel back some of the layers of the onion. What is it that's happening in mental health that's all making like white space for you guys and what you're bringing to market, and that's so unique and different from what everyone else is doing?
Yeah, it's a great question. You're right. There are a lot of innovators that are trying to enter the space, and mental health is all over the news pretty much every day, whether it's an athlete or a celebrity saying that they have to take time off because of a mental health challenge, or it's something tragic that's happening in the world that's tied to mental health. It's been, unfortunately, it's a growing industry, I guess is the best way to say it.
Mm-hmm.
But the innovators have been focused in a number of different ways, I think, on this problem. One, One way is treatment. Like there are innovators that are focused on, are there interesting or more sophisticated ways through technology or through innovation of some kind to treat mental health conditions?
Yeah.
The area we've been focused on is the prior to treatment kind of part of that, which is how do we recognize a mental health condition as early as possible so that we can direct the person who needs help to the right resource. And there are some things that have changed in the industry over the last few years. One is that your primary care physician really has to test you for a mental health condition at least once a year. That's
Mhm.
become a law, that's become a rule. That
Yep.
changed. But and no offense to the primary care practitioners out there, but they're not very good at it. That's not what they do. They don't
Right.
focus on mental health. So they'll do what's maybe called a PHQ-2. They'll ask you how you're feeling and whether you're depressed and leave it at that. But that really, and you're sitting in an office and you're sitting in front of a doctor and they're asking you a couple of quick questions and they're clearly trying to move on to your physical or whatever they're going to do with you.
Yep.
And they're not really focused on the answers. They're not really focused on what you're saying. And they don't expand that. They don't say, oh, based on those answers, I should ask you more. And I should dive in and I should go over here and ask you about this. It's not their area of focus. So they haven't really. So that's what we do. So we're like helping them ask
Mhm.
the right questions. And sometimes we help them ask those questions not in the office, through a text message or an email to the patient well in advance of their appointment so they can answer in the privacy of their home or maybe where they're in a setting where they can be honest with those answers. We found that people are more honest with answers, believe it or not, when there's not someone sitting in front of them expecting something from them, but where they can take their time with the answers and answer them truthfully. So that's what it's about, is helping people who are not good at this to be good at it.
What's interesting is that I'm a caregiver for my 94-year-old grandmother. And I mean, she's at 94, she's got a lot of different things going on. Thankfully, no mental health issues. But I will say firsthand, whenever I take her to the doctor, everything's great. I mean, there's just something about her wanting to like impress the doctor. I don't know. And I'm
Right.
like, what about this? And what about this? And all of a sudden everything is either gone or minimized. And then we get back home and it's all back again.
It's true. It's true. In a way, she's more honest with you because, I mean, and it's that thing where, you're more honest with the people that you're closest to,
Sure.
maybe for
Yeah.
better or for worse. But yeah, I had a similar situation with my mom. My mom had dementia in her later years, and we didn't recognize it early. We just didn't see it. We excused her behavior and just said, she's getting a little forgetful or this. And if we would have had some systematic way of analyzing her dementia and could have addressed it earlier, it would have made a huge difference to us,
Sure.
you
Yeah,
know?
absolutely. Quality of care, right?
Yeah,
Uh, and I think that's what's so special about what we are all doing in this industry, not just myself and you, but all of the listeners, is, healthcare is personal. And, it's usually either us or someone really close to us that's encountering whatever it is that we're trying to solve for in healthcare.
that's exactly right. And it does make you feel good when you can do that for a patient and when you can see that they're getting the help they need. Yeah,
Sure.
absolutely.
Yeah, absolutely. What a lot of what we talk about on this show is commercializing innovations, right? And I am a huge proponent to say, I don't know whether everyone believes me or not, but I don't think we have a funding problem. And people out there that are trying to raise money will probably disagree with me, but we are pouring mad amounts of money and capital into healthcare and health innovation. And I really don't even think we have a technology problem because there's all kinds of tech that's out there. I think what we have is an adoption problem. And so as the chief technology officer that's bringing this incredible technology to market to solve real health problems like we just talked about, what are some of the things that your organization is doing, whether it's the product, the customer experience, the UI, UX, marketing, whatever that might be, that is driving greater adoption that our audience can learn from?
Yeah, I couldn't agree with you more. I think you're right. There's plenty of technology, and there is plenty of funding if you've got a good story. You
Yep.
know,
Yep.
mental health technologies has been funded primarily through friends and family for quite a while now, because there are people in the space that are interested in solving this particular problem, and then there are people who like you and I have pointed out, everybody knows somebody who's experienced these issues. There's
Yep.
plenty of money. So you're right about adoption. It really is. It's so easy not to do something. We found that with our technology. We send these assessments to patients to get their honest answers, but it's so easy for the patient to just say, "Nah, not going to answer those questions right now." Or for clinics not to use it. It's so easy for a clinic who's doing this to say, well, you know what, it's hard to use, so I'm not really going to use it. I think that's at the core of it, is you've got to make it super easy to use, almost a pleasurable experience to use,
Mhm.
and you've got to have it provide assistance, help, and benefit in a great way. I mean, like clinics, look, they're like any other business, right? They're helping patients, sure, and you'd like to think that they're just completely altruistic and that's what they're in it for, but they're a business, they're in it to make money. So can our technology at the same time help their patients while helping them make money?
Yeah.
And we've zeroed in on that specific problem, and we think the answer is absolutely yes. And I'll give you a couple examples. One is in a primary care practice. It turns out that you can bill insurers for mental health testing.
Mm. Mhm.
Some primary care practices were not aware of that, but you definitely can. If you add that into your suite of services that you provide your patients, you can bill for it, and you get paid a good percentage of the time. Insurers aren't always completely reliable on that factor, but depends on the state, depends on what insurer, but most of the time you will get money for that. And then you're also benefiting your patient. And in a behavioral health practice, you can complement your behavioral health service with these tests. It helps you prove to the insurer that you should be paid, but it also allows you to redirect the patient to more advanced treatments. And those advanced treatments are billable.
Yeah.
So it's really a sweet spot
Mhm.
of matching, the helping thing that you're trying to do for your people, your patients, while at the same time growing your revenue. And, we focused on doing both.
So I think one of the things that you just touched on that's so incredibly, it seems like, of course, but it is often overlooked, is this reimbursement pathway that we have to make sure in our business model that we are thinking about, that reimbursement pathway, and making sure that it's defined and it's fleshed out when we go to market, so that way we don't have patients that want to use our tech, providers that maybe want to refer our tech, but no one's got a way to actually get paid for it.
That's right. That's right. And we have this line that we don't cross, right, at MHT. We'll like say, okay, we'll give you the information we know about billing, but we won't tell you how to bill. You
Sure.
know, that's your business. You're actually good at it. That is an area you focused on and learned and have the right resources to help you with. But we'll tell you what we think works in terms of complementing your services with testing. And we'll also tell you, based on our best information from doing this for now a number of years, when should you test? Because the when and the how you test is actually a tricky question.
Mhm.
And it's an area we've also focused on. And you mentioned AI earlier, we have a logic and reasoning engine that uses AI to tell you and to redirect the right tests to those patients, when they should take them and which tests and how they should take them. And that's a critical decision point.
To me, that's a game changer when it comes to adoption, is being able to have that intelligence. I think very often our number one competitor is that we overlook is just the status quo, right? It's just doing nothing different than what we've always done. And so how do we, so it sounds like an intelligence engine like you're referring to is going to help you overcome that, help you be able to deliver that testing at the right time to the right patient, the right test that would be a gateway or a pathway to being able to overcome those adoption hurdles.
That's exactly right. I mean, let's say you're just testing for depression. Let's make it simple, right? So you're testing your patients for depression, and you're testing them once every 6 months, sake of argument, right? But let's say the patient indicates some severe level of depression, or they indicate that they're somewhat suicidal. What do you do with that information? So
Right.
in our engine, we use it. We say, well, wait a minute, this patient is at a more severe level of depression. Let's test them more often. Now that sounds obvious, right? But it's just not happening in practice. So when we give them a systematic way to do that, and to make sure patients actually answer the questions, and then you get those in your EHR system right in front of you when you're doing the visit with the patient, we're
Yeah.
really helping the provider to know what to do at that point, and to point the patient in the right direction. And then they're tracking if they've got the patient in more advanced treatment, like there's something called transcranial magnetic stimulation. It's a way of using a headset and doing electrical stimulus of the brain, and it really works. It improves depression in a lot of patients. It works for a lot of severely depressed patients.
Mhm.
But how do you know when to put somebody in the chair? And once you put them in the chair, how do you know how to measure whether it's helping them or not?
Sure.
And that's what we do. We help them know whether it's working. So,
So it makes me think of a couple of things. One, let's talk about the clinical evidence that is supporting your technology and how that's playing a role in your commercialization strategy. Let's start with that.
okay. So evidence that this is making a difference, or yeah.
Yeah. Yeah.
So, right. So what we can do is we can do a before and after test, right?
Mm.
So like, let's say you've put a patient on a drug regimen, for anxiety, or, whatever it might be, or addiction, you've got a patient in addiction treatment. We can look at their testing and their progress in terms of their mental health state before the treatment and after the treatment. And then
Mhm.
we can say, you know what, did that treatment make a difference or not? If not, then let's redirect the patient somewhere else. Let's do something else. We can even, and this is an area of innovation for us, besides the AI thing, which is one of our key areas of innovation, we're
Mhm.
using analytics. So we're able to look at what's working and what isn't. Overall in the industry, we've collected now hundreds of thousands of data points
Mhm.
across lots of healthcare organizations, and we're able to say, this is what seems to work and this is what maybe doesn't work as effectively. And we're seeing patterns in the data, so we can use analytics that we've collected in a clever way. We can use it to be an advisor to tell people, maybe what works and what doesn't. And we can also use it to help you compare your clinic to a broader benchmark
Yeah.
and
Baseline.
say, am I different, or am I kind of seeing what other people are seeing in this industry? So it's kind of that, using analytics to be a smart tool for guiding a clinic toward doing the things that are most benefit to their patients.
I have to
That's
say, I don't know who on your team came up with Smartest AI, but I really love it.
Thank you. Appreciate that.
Great brand,
Yeah.
brand name. Yeah.
That was our CEO. Our CEO
Uh-huh.
came up with that, and his name's Ernie. And it was, I agree with you. It's working amazingly.
Yeah, yeah, exactly. So we talked about, building the clinical evidence. But you also touched on something that I think is worth diving deeper into around making it easy to use. So there's a whole lot that typically happens between I have an idea of what I think something should look like, and then that eureka moment where patients love it and use it and think it's amazing. And a lot of times there's testing that's happening, there's experimenting that's happening with real users, with beta testers. So kind of maybe walk us through, as the CTO, what are some of the things that you've done with testing and experimentation to be able to get to that user experience that patients and providers are loving enough to continue to drive adoption?
I'll give you an example, and this is probably going to sound stupidly obvious to you. But let's say a patient has a mobile, a smartphone, and they have an email address, and you say, okay, how should I send them the test? Should I send it to them on their smartphone? Should I send it to them via email? Or should I send it to them via both? Or should I have an iPad in the clinic that I hand to them when they come into the office for their appointment, and they just take it right then and there?
Yeah.
And this is what we found. And this is, you wouldn't think about this, right, in advance. I didn't think about it. It wasn't until this was actually in use that we started to see this.
Yeah.
I thought, well, the device, of course. They're coming in for their appointment. The person hands them the device and they'll take it, and we'll get 100% rate of adoption because the patient's right then and there. Except that during COVID, clinics lost a lot of their administrators.
Mm-hmm.
People just were leaving healthcare organizations for whatever reason. They didn't feel safe. They didn't want to, there were risks, whatever. It was too hard. They didn't want to. So the number of administrative staff in various clinics and healthcare settings went down, and the administrators that are still left got busier. And they're so busy that they don't have time to be saying, should this patient be handed an iPad or not?
Mm.
They just, so then we thought, well, maybe put a kiosk in the office, and that works for some clinics, but not for all, for a lot of reasons. So we found that usually the communications mechanism works better. Plus, it allows the patient to do it on their own time in the privacy of their home, like we talked about, and get better answers. Okay, great. But then I thought, well, why don't we send to both mobile and email at the same time? But patients felt like they were harassed. They're getting a message over here. They're getting a message over here. What are they supposed to do? Did I supposed to take the test twice?
Spamming me.
Right. So then we thought, oh, well, then let's just send it to mobile, except some patients didn't give their mobile number to the clinic. They only have an email address. So what we figured out, believe it or not, the best approach is if they have a mobile, send it there first. And if they don't, send it to email first. And if they don't, try the device. So we kind of have a chain. And it sounds dumb. Well, how do you send a test to a patient? But it actually makes a significant difference in adoption. And trial and error.
Yeah.
That's the way we figured it out, But now we can advise clinics on how to do it.
Sure. Yeah, absolutely. As someone that with a marketing background, omni-channel is often the best path, because patients or people are going to see something, not take action, see something, not take action, see something again in another channel and go, oh yeah, forgot about that, and then take action. And so what we've kind of evolved to, which is what you're leading to, is preferences, and really being able to empower patients to be able to identify what their preferences are up front. So that way it's a personalized experience across the patient population instead of a one size fits all, because there's no way that all patients want any one device or any one pathway. We're all unique human beings. So you're going to always have a diversified preference.
Yeah, I've always hated one size fits all in clothing. And you're right,
Yeah,
it works in communications as well. You're absolutely right.
Oh, yeah. Well, that's really powerful, because I think that sometimes we set it and forget it. And it's not until we really have major problems with adoption that we go back. And sometimes the perspective is that they don't want it. And it's not necessarily that they don't want it, but it could be, I just don't want it right now, or I don't want it in this channel. So really being able to figure that out, I think, is very valuable.
That's right. And when the same kind of approaches work with frequency of testing. This is too much. This is too frequent. This is not enough. We've through trial and error, we've figured that out. The same with billability, like we talked about. What can you bill? What kind of frequency can you bill when knowing that about different kinds of tests and different kinds of treatments? It's just, there are so many factors here that, you think about just sending a patient a test and getting results back. What do you do with the results? How do you make them actionable? We've learned that. So there's just so many factors here for something as simple as doing a test and getting a result.
Right.
You
Right.
know,
Yeah. Uh-huh. So what are some other lessons learned, some of the challenges that you guys have encountered on the commercialization journey? Because we like to, be a real candid here about how difficult and how complex it is, especially in healthcare. So as you think about your experience, maybe in other industries, what are some of the things that have been more challenging and how in healthcare, and how have you overcome them? And what are some of the things that you're like, wow, as a whole, healthcare is really missing this, but because you have that expertise and experience in other industries, you're having maybe greater success than some others.
yeah, I think listen to the user is our number one mantra, right? Like when we talk to the people who are actually using the application and seeing the results coming back, one key factor for us is put the information in the place they look. Again, it sounds dumb. I mean, maybe I have just this habit of saying things in this sort of stupidly simple way, but it's
Mm.
they live in their EHR system. They
Yeah.
don't live in our application. Our application is an add-on. It's something off to the side. So we've discovered that integration is so critical to success here. And we can do integration, interestingly, in a couple of ways. We can do it manually. Like if
Mhm.
we actually don't have an integration directly to their EHR, because we haven't done that EHR yet, or for
Right.
whatever reason, we can actually use resources to enter the information and put them in front of them manually. We have a team of people that does just that. It makes it look like an integration, but it's a behind the scenes integration done with human beings,
Yep.
you know,
Yep.
but
Mhm.
that works, you know. But if we've built the integration, all to the better, right? Because then we've built the way of getting the data into the HR so that when they bring up the visit in the notes, there's our test results right there. And there's the interpretation of those results right there. What does that score mean? Are they suicidal? What do you do? It's all right there.
Mhm.
And so getting it in front of them in a place where they live was absolutely critical to success. And again, something we learned and something we're doing now as a matter of course as we sign up new clinics. So yeah.
So one of the things I think is interesting that you're kind of touching on is the importance of I'm building it and I'm testing and iterating. And at some point we've got product market fit, and now we can go out and scale across the market and maybe even scale with new products and solutions. I think one of the things that happens as a common pitfall in this commercialization journey is people tend to try to scale too fast, and trying to spread their resources of, shiny opportunity syndrome of, oh, well, we could also help this sector. We could also help this practice type, or, oh, we could build these different technologies, and kind of get spread so thin and lose that focus, and haven't really even proven the business model, or that product market fit to be able to say, okay, now we're at that point of scale. And it sounds like you guys have really focused on that before you're getting to that next scalable level.
Yeah, there's a book that I love, actually. It's an old book. It's called Crossing the Chasm. It's by a guy named Jeffrey Moore. You're familiar with it, yeah. And I think it was written back in the 80s. But it's a book for like product managers, people that are focused on fitting the products to the market that they're marketing it to. And what is your market strategy then for maximizing adoption, and how do you do that? And he wrote about that, and the way that we're trying to do that, interestingly, is through a kind of ecosystem. So like, we'll go into a state or a city like Texas, in the, say, the Dallas area, and we'll find that the best approach for marketing and positioning the product is to have a behavioral health hub, a behavioral health clinic with a bunch of primary care clinics kind of around it that
Mhm.
can refer patients who actually need real help from a behavioral health practitioner
Yep.
to that behavioral health practice. These primary care practices, they don't have mental health people on staff, so
Mhm.
they need a referral approach to do that. So if we can get our technology in use by both behavioral health clinic and primary clinics who refer their patients,
Mhm.
now we've hit that sweet spot, and we can really hit that market hard, number one, in terms of adoption of our technology, but in terms of helping all those clinics, both the primary care type clinics and the behavioral health type clinics, because they've got this ecosystem that kind of feeds itself. And that works really, really well. And then we can say, okay, now we've done this in Dallas. Now let's go do it in Houston, or let's go do it in Chicago, or let's go do it in Phoenix, or wherever in the country. And if that model works, we can propagate it across the US. And that's what we've been focused on doing.
Awesome. That's fantastic, John. Great
Thank you.
wisdom. Great wisdom to share with our audience. So as we wrap up here, what is there anything else that you would want to share with folks before we wrap up?
Just think about, I guess, our kind of motto is, you can't change what you can't measure. And again, sounds simple, but I think that's true. And mental health has been this area where, how do I find the people that need the help as early in the process as possible, and how do I get them the resources they need? And if you think, well, there's ways of measuring their condition that can really contribute to that problem.
Yeah.
Once you accept that fact, then we can help. And we'll guide, through our experience, we'll guide as best we can, but it's up to you how you want to deploy all this. You make all the decisions. We just provide you the technology, the tools, and some advice for how you might take advantage of it. That's really it.
It's awesome. So how can folks get a hold of you if they want to follow up with you after the show's published?
Our website is www.mhtech.com. You can go to the contact us section of the website, and we'll be glad to get in touch with you. Or if you want to reach me directly or ask me any questions, my email address is john, JOHN, @mhtech.com. Happy to be in touch.
Well, thanks for joining us today.
Thank you, Dr. Roxy. Appreciate it.